So I'm going to talk about what's really behind a glute or gluteal spasm when you're on keto. Let's say, for example, you have a cramp or muscle spasm in your butt, or you've been diagnosed with deep gluteal spasm, or you've been diagnosed with this thing called piriformis syndrome, which is a muscle underneath the glutes. Realize this is an electrolyte deficiency. Primarily, it's going to be sodium, a sodium deficiency. It just means that you're not consuming enough sea salt. This happens all the time when you start a keto plan or you're doing intermittent fasting. You lose a lot of water, and with the water loss, you lose sodium. So you need to increase the amount of sodium. In fact, if you've tried potassium, magnesium, or calcium for cramps and it still hasn't worked, try more sea salt. And I would recommend, depending on if you exercise or not, 1 to 2 teaspoons a day. If you're exercising, you may need 2 teaspoons. Now, the problem with salt cravings is that you're not necessarily going to crave salt itself. You're going to crave what your body remembers as salt in the form of popcorn, chips, pretzels, that type of thing. So there's a couple things you can do. You can just add more salt to your food. You can add some sea salt to your water and dissolve it and drink it down with your lemon. You could get sea salt in little capsules. Make sure you get the Himalayan sea salt, which is the absolute best. The volcanic-rich salt in Hawaii is also really good. Now, other problems that you might have with a sodium deficiency would be a worsening of POTS. That's a situation where you stand up too fast and you get really, really dizzy. There's an entire condition on it. I did a video on this. I'll put a link down below because if you have this, you need to take vitamin B1. I have a lot more information. Or it could be low blood pressure. You need more sea salt. And there's a condition called hyponatremia, and that is low salt in your blood. And that usually comes from consuming way too much water without salt. It could be very dangerous in your body, especially if you're exercising and you're putting all this water without the salt. It dilutes your electrolytes even more, and the heart starts to work harder and harder and harder, and you can get actually swelling in the brain. It's a big problem. Addison's disease, which is a condition with the adrenals, in which the adrenals are not manufacturing enough adrenal hormones. So the person's going to be losing a lot of salt. And you may see this if you have severe adrenal fatigue or some type of dysfunction with the adrenal. Now, if you have Cushing's syndrome, you might be retaining salt, okay? But the opposite of that would be Addison's. So if you don't have enough adrenal hormones, you're going to be losing salt, and you need to be consuming a lot more salt on a regular basis, or you're going to feel very, very weak. The more you exercise, the more salt that you need. Make sure, of course, it's sea salt. But depending on how much you sweat, that will determine how much salt you need. But some people even need more than 2 teaspoons a day. All right, if you feel weak muscles, you need more sea salt possibly, or fatigue, try adding more sea salt. All right, so there's a summary of the sodium deficiency, but if you have a cramp in your butt, try some sea salt and it may just help you. Thanks for watching. Hey, if you're liking this content, please subscribe now, and I will actually keep you updated on future videos.